Let's talk to Dr. Dean Eggett, GP in Doncaster, CEO of Doncaster's local medical committee. Our favourite GP, of course, here at Morning Glory. Dr. Dean, very good morning to you.
Morning, Mike. Merry Christmas.
Merry Christmas to you too. What are you expecting over the Christmas period? We keep hearing that, funnily enough, I just got a message from Jeremy Kyle, who's at Kibosh. We were supposed to be going out tonight, but he's not very well. He's got a bad throat. Almost everybody I know in the last 2 weeks has had something like a cold or, a bad throat or, a runny nose. Nothing terrible, but just something kind of annoying.
Yeah, all of the infections have hit at once this year, Mike, sadly. So we know the NHS is on its knees. It has been for the last decade. But at the moment, we're hit by this so-called quaddemic. So it's the four big hitters that come every year. But this time, rather than spread out over the winter period, they've all come at once. So there's influenza, there's COVID, there's a virus called respiratory syncytial virus, and last of all, there's norovirus. So hospitals and people and the nation is on its knees, as you've noticed with the problems with trains and roads and everywhere.
Yeah, it really isn't good. And hospitals, of course, many of them at the moment are saying they haven't got any bed space at all. Because, again, this is what happens at this time of year. Why is it that they can't, over the course of the previous sort of 11 months, because they know this is coming, make more space or do something to kind of ameliorate the problem?
Well, to a certain extent, they have. So 1 in 20 hospital beds at the moment is affected by one of these four different viruses. So the majority of our hospital beds are taken out of action. So the only thing that you can do is try to increase hospital capacity over the winter season, but that costs an absolute fortune. And the reality is that our hospital infrastructure in the UK is in such a poor state, there literally isn't the room for the beds. And then where on earth are the staff to look after the beds? So if you needed to increase hospital capacity by 5%, 10% over the winter period, it's practically impossible with the infrastructure that we've got.
But why can't they just take that by the sort of the scruff of the neck at some point or other in the year and go, look, we know this is coming. I mean, I read it every single year in The Guardian, once again, a winter crisis looming, the quaddemic or whatever it's called. Every single year it's the same. It hits around about sort of October the 31st as you're getting out of Halloween into November. And it seems as though they haven't done any preparation in the previous 6 months.
There has been some preparation, to be fair. So the main theme at the moment is this concept of a hospital at home. So patients are looked after in the community by workers rather than actually going into the hospital infrastructure. Because like I said, the main solution here is going to be to expand hospital space, expand beds and expand staff. And quite frankly, that costs money and there is none. So if there's no money, how can you afford a massive expansion in hospital infrastructure over the winter period?
When you say there's no money, there is 200 billion swirling around in the system somewhere.
Yeah, well, so there's not enough money spent in the right places, and I've spoken quite a lot about this. There's plenty of cash in the NHS, but it's not necessarily in the right place at the right time.
No, listen, this is one of my big bugbears. I say this to people all the time. It's not as if you haven't got enough money. You just haven't got anybody spending it in the right way. It needs to go to the front line. It needs to go to clinicians. It needs to go to people like you. It needs to go to, hospitals. It doesn't need to go to, say, £300 million worth of data protection to some American data farming company, and all these ridiculous contracts that they seem to have all over the place, spending billions and billions of pounds out of the 200 billion, nothing to do with actual medical help for people.
You've said it for me. I'm inclined to agree. But one of the positive things we have heard over the past few days is that the government have invested in hospices, and nobody can argue against that. Hospices are a brilliant investment and they do need help. But there has to be something said about, we're not investing in prevention of health. We're not really investing in hospitals. What we're really investing is the end of life. Now, the end of life does need investment, but if that's the strategy of our government, really just to invest in end of life and not really care about the rest, that worries me somewhat.
Yeah, right. And looking back on the first 6 months of this government, and they'll always say, well, we haven't had enough time to do anything. Has anything improved in the NHS since they've been in?
No, you know what? I was thinking about that this morning on the way here, thinking about this interview, thinking what tangible difference has this government made to the NHS at the moment? And actually, the only tangible difference is things are worse. And things are worse simply because of national insurance and increase in minimum wage. Right. So all industry is going to be affected by this, including healthcare and social care. We are going to have to lay off staff because we can't afford to continue to run services. So expect in the next year, unless there is a solution, healthcare is going to get worse.
That is incredible, isn't it? Are they not supposed to be compensating public sector organisations like the NHS for paying the national insurance hike? Because I thought I read that somewhere. But if you're, as a doctor, saying to me that you're not going to get that, then that's a ridiculous state of affairs, isn't it?
What we've heard directly from the government is that GPs are not part of the NHS family and therefore will not receive any compensation
Right.
for this. We've been told to hold tight because there might be some help coming by April. Now, quite frankly, we can't wait until April because that's when the costs hit. So action is being
Right.
taken now across the NHS to save costs.
It's unbelievable, isn't it? And what are you doing over Christmas, Dr. Dean? Is your surgery open, closed? What goes on?
So my surgery is open apart from Christmas Day and the usual bank holidays. So we'll be looking after patients. As you can see, I'm here ready to go, looking after patients today. But just bear in mind that the NHS, people in the NHS, such as myself, we get sick too. So it's a difficult period for all of us. And it got me thinking when you were talking about the roads and people driving and hospitals being jam-packed, just take it really steady on the roads over the winter period, because the last thing you want is a road traffic accident and ending up in hospital, because you'll probably sat in an ambulance rather than in the hospital itself.
Yeah, absolutely right. Good to talk to you. Have a great Christmas, Dr. Dean. We'll see you next year. Wouldn't it be nice if he could have said, yeah, the Labour government have been in for 6 months and they've really, really made a difference. And when I said, what's improved since they've been in, he said nothing. Nothing at all. Not a sausage, bugger all. Nothing. Nothing. Listen to that. Wes Streeting and Keir Starmer.